We are live, ma'am.
Okay, Praveen, you can start with the introduction.
Yeah. Good afternoon, everyone. On behalf of Cardidium team from Alembic Pharma, I warmly welcome participants to the today volume matters webinar. Today's topic is lifestyle tips in hypertension management. Now I am pleased to introduce our speaker, Dr. Nalini Madam, who will guide us on simple and practical lifestyle methods for better BP control. Thank you, Madam, for joining us today. Over to you, Madam.
Yeah, we planned for it in Telugu, I guess. Shall I continue with English?
Yeah, okay, Madam.
Okay. As we all know, we are celebrating the World Hypertension Day on 17th of May every year. This year, the theme is like understanding and controlling the blood pressure. Almost we combinedly control the blood pressure. So next slide. So understanding volume and blood pressure here. So volume, why it is important for controlling the blood pressure. The excess salt intake increases the body fluid volume, putting extra strain on the heart and leading to a high blood pressure. So excess salt is causing a fluid retention. It indirectly increasing blood volume, and increased blood volume makes the heart work harder, indirectly increasing the blood pressure. Next. So the recommended BP targets are for the adults with the hypertension, the recommended BP target is less than 130 by 80. And whenever the patient is having another comorbid like diabetes or CKD or any cardiovascular disease, the target comes little lower, 120 to 129 by 70 to 79. Next. So, what all we need to do for the controlling blood pressure? Follow DASH diet. This is the first what we suggest for each and every patient already who are on medications also. So, what is DASH diet? Dietary approaches to stop the hypertension. So, eat more of fruits and vegetables and whole grains. Avoid processed food and choose low fat dairy, nuts, fish, and poultry. Good sources of the protein and healthy fats naturally available, and get enough of potassium, magnesium, calcium, and fiber from the fruits and nuts, and help support which these potassium, magnesium help support healthy blood pressure and overall health. Next slide. So reduce salt intake, that is very important. As we all know, Indian settings, the consumption of the salt is little on a higher side. The what we suggest is less than 5 grams of salt per day, and avoid processed and fast foods as they contain high amount of the salt. Hidden salt is more amount it is there, and potassium rich salt alternatives. Not all for the all patients. You can consult your doctor and then decide regarding the potassium rich salt alternative. Consumption of the regular salt in a lower number, lower gram, that is very important. So stay active every day. This is very, very important. Say every day 30 minutes of exercise, continuous of walking or jogging. So every day 30 minutes, and aim for, or if 30 minutes every day you are not, okay. 1 second. Cannot start on this.
Okay, madam. Okay, go ahead.
No, it's okay.
Okay, ma'am.
Yeah. Sorry. Stay active every day, that is very important. So regular physical activity helps lower the blood pressure and improve overall heart health. So every day 30 minutes of the exercise is very important. If every day 30 minutes you cannot spare at any, I mean, because of your lifestyle, so at least 60 minutes of the intense exercise or 300 minutes per week is suggested. But overall, every day 30 minutes is comparatively very good than spending weekly 300 minutes of intense exercise. So move more, sit less. This is very, very important for a healthier heart and lowering blood pressure. Next slide. So stay calm and stay healthy. This is very important for managing the blood pressure. So sympathetic overdrive is the important reason for overall hypertension in Indian settings. So managing stress through yoga, deep breathing, and meditation can help lower blood pressure and improve the overall well-being. So you can so yoga helps in reducing the stress and support. Use deep breathing exercises to relax and lower stress, and try meditation for calmness and focus. And whenever you are in a continuous work for almost like 8 hours or 10 hours, just a pause of 2 minutes or 1 minute in an hourly interval basis also helps to reduce your stress levels. Next slide. So good gut health is also important for lowering the blood pressure. The latest data is showing more amount of the healthy gut flora. The healthy gut flora is an important one. So a healthy gut flora can reduce the inflammation and may help the lower the blood pressure. So to maintain a healthy gut flora, eat more fiber from the fruits and vegetables and whole grains, and include gut and probiotics. Add prebiotic and probiotic rich foods like the nuts and vegetables and curd. These are all important things. Cut down on the processed foods and excess salt and saturated fats. Take care of your gut and take control of your blood pressure. Next slide. So build healthy habits. So good habits along with the medications help control of the blood pressure and protect your heart. Whatever we are showing here, each and every one has gone through an intense trials. So avoid alcoholing will reduce the blood pressure. Good healthy lifestyle will help in reducing the blood pressure. Avoid smoking. So smoking is like almost 30 minutes of smoking. De-addiction can reduce the blood pressure. We all see from the theaters this one. And limit caffeinated and sugary drinks. This is also very important. Next slide. So overall, for the World Hypertension Day of 17th May, I'm going to tell like improve your healthy lifestyle to maintain your blood pressure. Thank you.
Yeah, thank you, madam. Thank you very much for the informative session.
Yeah,
madam. Now we will begin the question and answer session, madam.
yeah.
Yeah, participants can share their questions in the chat box, and I will read them out for the doctor.
Yeah.
Yeah. Doctor, one participant is asking, how much salt should we take daily?
Less than 5 grams. Less than 5 grams is like 1 tablespoon. 1 tablespoon of salt with your breakfast, dinner, lunch together, everything together, 1 tablespoon. Which is not possible in Indian settings practically, but you should control your salt intake. So avoid highly salted pickles and all. Avoid fried items, so that includes, and avoid table salt.
Madam, another participant is asking that, can BP become normal, madam, only with lifestyle changes?
That is where your diagnosis point is very important for putting you on lifestyle modifications. So if the BP is diagnosed early without any organ mediated damage, yes, definitely through lifestyle modifications we are going to control your blood pressure. But consistency is the key here. Whatever the lifestyle modifications we are doing, we are suggesting you have to do it regularly, and you shouldn't take a break, like festival is there, functions are there, or like that. So the consistency is the key. If you are consistent, anything can be possible. Without medication we can achieve.
Okay, madam. What type of exercise is best for BP control, madam?
I didn't get you.
What type of exercise we have to do to control the BP?
So both the isometric exercises and cardio exercises are equally important. So just a simple walking, 30 minutes of walking, if you are having a sedentary lifestyle, I can suggest you to start with that, because it will not require any gym things or anything like that. You can walk at any place wherever you have. So continuous walking for 30 minutes is also ideal. But along with that cardio exercises, if you can include some resistance exercises like simple dumbbells, at least of a half kg or 1 kg, 30 sets, or without any dumbbells, some hand raising, leg raising exercises, if you can do a set for at least 10 minutes, that is also okay.
Okay, madam. Madam, we can eat pickle or papad like that foods, madam, occasionally?
Pickles and papads are contain high amount of the salt. If you are I mean, if you are fond of them, okay, you have to cut down the salt at any other thing. If you're taking, I won't suggest to eat that directly on a live session. But see, if you want to eat them, take a lot of water at that point of time and limit the content, limit the amount. So if you want to eat a papad, you can taste it. If you want to eat a pickle, just taste it. That's it.
Okay, ma'am. Thank you. Madam, one participant is asking that tea or coffee is harmful for BP patients.
No, we
Tea,
all said
coffee.
in the slides we have shown, so the caffeine and nicotine, both caffeine is a direct, it can increase the blood pressure. So if you are an addict of tea or coffee, 1 cup per day is fine, but 1 cup is like literally small cup, it has to be taken. Avoiding tea or coffee is ideal.
Okay, madam, we can stop the medicines, madam, once BP is normal.
With the advice of your doctor, if you are taking a medication, if your BP is normal, that means your BP medication is adequately controlling the blood pressure, so you shouldn't stop. So if with the medication, if the targets are achieved and less than the targets, if your blood pressure is being recorded, then definitely okay, you can come down with your dose of medication. And if you are consistently enough doing the exercises and all, then we can stop the medication, but with the advice of the doctor, not with the decision of a patient.
Okay, madam. Thank you, madam. We covered all the questions from the participant. Madam. Madam, thank you, doctor, for your valuable guidance. I also thank you all the participants for joining today's webinar and making this session successful, madam. Stay healthy, stay active, and take care of your blood pressure. Once again, thank you, everyone.
Thank you.
Thank you very much.